Hello, everyone. So let's discuss this topic, Notss. That the full form is non-technical skills for surgeons and how to apply it in gynecology cases and also in the clinical practice. So this is also a very important topic. And what is the definition? It means that is the Notss. It refers to the cognitive and interpersonal skills which is required for safe surgical practice. And what do you mean by cognitive skills? So it means the mental ability to think, learn, and remember the facts. And interpersonal skills means having like effective communication and interaction with your colleagues, and also the ability to work with individuals and groups. And why is Notts important? Because it improves the patient safety, enhances the teamwork and communication, and it supports better decision making under pressure. What are the key Notts domain? There are 5 domains, okay? Situation awareness, decision making, communication and teamwork, leadership and resource management, and coping with stress and managing errors. So we are going to discuss about them in detail one by one. And yes, I have tried to keep it as simple as possible. So situation awareness means like information gathering. So information gathering, it includes like taking the history, offering examination, and also offering the investigations and gathering information from the given investigations. And we have to understand the information, like interpretation of CTG, for example, uh, interpreting the ultrasound, okay, and the blood test results. So correct interpretation is very important. Anticipating future events like recognizing complications like massive PPH or uterine rupture. So this is related to the obstetric cases, of course, like in patients who are having multiple pregnancy, and like if we are offering the instrumental vaginal delivery, these patients can have massive PPH, okay? And those with previous history of PPH, of course, they are at risk. So we have to anticipate the complications. So another example is managing a ruptured ectopic pregnancy. So ruptured ectopic means, yes, we have to anticipate shock, prepare the resuscitation, and arrange the urgent surgery. So we have to communicate with the operation theater as well, and communicate with the blood bank as well to prepare the blood after ruling out any reservations for the blood transfusion, like after ruling out whether patient is a Jehovah's Witness, and communicating urgency to the team. Now, coming to decision making. So, what are the steps? First is we have to identify the problem, and then we have to consider the options, like which management is appropriate, whether it is conservative or surgical management, and what are the like risk and benefits of each management option. For example, if there is a patient with ovarian cyst, then whether we should offer conservative management or surgical management, and then we have to weigh the risk and benefits. And also, we have to take responsibility for the decision. We have to justify the decision confidently and take the action promptly. For example, if there is a patient with PPH, then what type of management we have to do? Mechanical, medical, or surgical. So if the patient is a Jehovah's Witness and she's refusing any blood product, in that case, we have to manage and treat PPH very, very appropriately. It's going to be a very urgent case, and we have to make the decisions very urgently. Okay. And in these patients, we know communication, resuscitation, management, investigation, monitoring, everything has to be done simultaneously. What about communication and teamwork? So this is the third domain of Notts. There has to be effective communication. So we are familiar with S bar tool, This is the situation, background, assessment, and recommendation. And we have to provide clear instructions to the team. There has to be teamwork and collaboration. That is working effectively with your colleagues, with your midwives, anesthetists, other specialists. And we should encourage input from all our colleagues, including the midwives, anesthetists, pediatricians. Okay, so we have to involve the colleagues. That shows good teamwork and collaboration. And we have to provide clear instructions, delegate the task effectively in emergency scenarios. For example, if there is a patient with shoulder dystocia, we know it's an emergency. So we have to lead a team in such emergency situations with a clear, calm communication. Of course, we have to call for help, and at the same time, we have to direct the maneuvers like McRoberts maneuver, suprapubic pressure, and also ensure that neonatologist and neonatal resuscitation is available. Fourth domain is leadership and resource management. So here, this includes prioritization and delegation. This means assigning the task effectively in emergency, and calm and composed approach. And even in under pressure, we have to work very calmly and we have to be very composed. And using resource efficiently, it means optimizing the theater time, using the blood products efficiently, and also check the staff availability. Now, good example is coordinating multidisciplinary care like MDT management for a woman with severe preeclampsia. So what needs to be done here? We have to coordinate blood pressure control, giving the antihypertensives, appropriate fluid management, magnesium sulfate administration, and when we are giving magnesium sulfate, how to monitor the patient and planning delivery. And we have to keep the team updated at all times. Fifth domain is coping with stress and managing errors. So we have to recognize the stress. This means maintaining composure under pressure and like self-awareness, that is recognizing the stress and maintaining the professionalism at the same time. Error management is also very important. So here we have to address the mistakes constructively and ensure the patient's safety and document appropriately. Good example is managing an intraoperative bladder injury. So first we have to acknowledge the issue, inform the patient and the team about the injury and involve the urology, and documentation has to be very meticulous. And we know that mastering Notss in gynecology and in gynecology cases and in clinical practice, it enhances the patient's safety, teamwork, and decision making. So this was about the Notss and application of Notss in clinical practice. Thank you. I hope it was useful. So it is also a very important very important topic from examination point of view. So all the best to all of you, and keep calm and keep going. Okay, so all the best for the upcoming exam. Thanks again for watching, and just please do subscribe and like my channel. I shall be uploading more videos related to the exam scenario. Thank you so much.